So on behalf of PRECI, I'd like to thank you for joining us today. I'm Denise Luscombe, Chair of PRECI, and really pleased to see so many people online. We are well oversubscribed to this webinar, and we still have over 250 people on the wait list. So the good news is, as you would have noticed as we came in, we will be recording the session so people can view it after. We understand that there is a lot happening a lot of change happening in the ECI sector, and I know we're all keen to learn as much as we can about thriving kids. And PRECI will continue to advocate for the National Best Practice Framework to be the basis for practice within thriving kids services and supports. Before we start, I would like to acknowledge the traditional custodians of this land and the lands where you're joining us from today. I'm on Whadjuk Noongar Boodja in Western Australia. I pay my respects to elders, past and present, and to any Aboriginal and Torres Strait Islander peoples here today. So this webinar is the first in a series of webinars that we will be organising, and the focus of today's is practice in ECI. You have all received in your email the link to 3 documents: the framework, the Thriving Kids Advisory Group report, and the PRECI Thriving Kids discussion paper, and we can also put those links into the chat. We want today to be as interactive as possible, and we ask you to utilise the chat to do this. There is definitely going to be opportunity for Q&A. We've left plenty of time for that, so you can come on video and ask your questions as well if appropriate. For any questions that we don't get to today, we will put the answers on our website. I do want to make a comment about how we interact today. I want to acknowledge the enormity of this subject and how important all the changes are that are happening in our sector. We do acknowledge and understand the stress and worry being felt at the moment. We want this session to be really welcoming and as inclusive as possible, so please ensure that any comments are respectful and inclusive. We want everyone to feel that they can take part and everyone to have their voice heard. I also want to mention, if you're finding the session or the conversation distressing or difficult, please take a break or even leave the session. As I said, it is recorded, to take care of yourself or talk to someone. So look, let's begin. I would like to introduce who we have online today. So I would like to introduce our special guest, Professor Frank Oberklaid, who is co-chair of the Thriving Kids Advisory Group. So thank you, Frank, for being here. I would also like to introduce Dr. Anoo Bhopti, who is also a member of the Thriving Kids Advisory Group and is also a PRECI director. And I'd also like to introduce the PRECI Framework Project team who are online. Dr. Susanna Gavidia-Payne, Kerry Bull, Tim Moore, and myself. So we will be focusing on the chat as well as providing information where appropriate. So Frank will cover the rationale, the process and outcome of the Thriving Kids Advisory Group. Anoo will cover the model outlined by the advisory group, and we will then open up to Q&A. Okay, so Frank, I would like you to come on screen and take over.
Thank you very much, Denise. It gives me the opportunity to acknowledge country. I'm actually on Wurundjeri country. I'd like to also pay my respects to elders past, present and emerging. I'd also like to acknowledge the people in PRECI that have taught me over the years. Tim Moore, obviously, because we're 5 meters from each other in the centre. Learned a lot from Tim, but also from Susanna and from Kerry and quite a few other people. And as we were setting up the advisory group, I took advice from PRECI as well. So I just want to acknowledge all of those people. Can we have the next slide, please? I think the rationale everybody understands, but let me go through it very quickly. The NDIS just did not work for kids. And as a paediatrician, I and my colleagues, and I know a lot of our patients, were increasingly frustrated. it really was an adult disability model transposed to children. Like so many other policy initiatives, children are still seen as appendages or small adults, and it's just assumed that the service frameworks and policy frameworks that governments develop for adults are suitable for children, and they're often not. The main thing was that children needed a diagnosis to obtain services. Um, and it really distorted clinical practice. So pediatricians would get referrals not to assess the child and come up with the formulation and recommendations, but with a request, please confirm a diagnosis of autism, because that was the only way to get services. It was focused on deficits and weaknesses rather than a balanced model of strengths and weaknesses. It was therapy model. Once you had a diagnosis that diagnosed deficits, then obviously it followed that you had to treat the child. The focus was on the child, so the parents were often not considered. It was market-based and open-ended. The outcome that parents sought wasn't a good outcome for their children, but the amount of money they received. So a good outcome was a lot of money, because then parents could go and look for the sort of services. So there was like a two-step process. First get the money, and then once you had the money, there was often waiting lists and equity issues even then. It was a very complex process to get in, and parents, in addition to waiting to get a diagnosis, then had to wait to get therapy. So we were very pleased. Next slide, please. We were very pleased that the minister broken. He actually asked for the NDIS when the government was re-elected. He added that to what was already a large portfolio. But the process was interested and comprehensive, and it's worth just spending a little bit of time on this. You will recall he made an announcement at the National Press Club that the foundational supports were going to be merged into a new program called Thriving Kids. The responsibility for foundational supports at the same time was transferred from the disability section of the health department to health. He set up an expert advisory committee that he and I co-chaired, 17 people on that, including quote unquote experts and also people with lived experience. Very strong secretarial support, and the Secretariat did a huge amount of background work, which Anoo and I were very, very impressed with lit reviews, very detailed analyses and integration of previous relevant work that the governments had done. And quite apart from our consultations with stakeholders, they went through their own process of speaking and listening to a whole lot of other groups. At the same time, there was a parliamentary health committee, which was chaired by two paediatricians, so Mike Freelander and Monique Ryan, and they received literally hundreds of submissions, and quite a few stakeholder groups and individuals presented to them face to face. And that they reported back to the Expert Advisory Committee on two occasions. So we needed to make sure that the submissions they were getting and our considerations were on the same page, and they were. There were three formal all-day meetings that went from about 9 till 4:30 or 5. There were presentations from the Secretariat and from government departments. There was focused discussion based on those presentations, very, very comprehensive minutes and notes of decisions taken. And to give you a sense of the process, the minister came in the morning and stayed all day on every one of those days, and which was just an indication of how committed he is and how engaged he was in the whole process. Very much on top of the detail. He would argue with us, he would concede ground, he would listen. It was really very impressive. And during those 3 days where he was there all day, didn't look at his phone once. And the other people there was the secretary of the department, Claire Comley, the deputy secretary, and all the secretariats. So the government was really fully engaged. In addition to those 3 formal all-day meetings, there were 6 deep dives, and that gave the opportunity for people outside the advisory group to have their say. there would have been 20, 30 or upwards of 30 people at each of those dives. The topics for each were identification and early intervention, needs assessment and referral pathways, best practice model of allied health, key workforces, state and territory delivered services, parenting programs, resources and advice, and lived experience. Next slide, please. In addition, the Secretariat were having at the same time separate consultations with the states, with disability representative associations, with various partnerships and consultation, various committees. I consulted separately with the NDIS Reform Advisory Committee and with the partners, and informally with paediatric institutions and individual experts. And there were 68 additional stakeholders involved in that consultation process, including participation in deep dives. So that's a pretty comprehensive consultation process over a very short period of time between August and December. So August was when the Minister announced at the National Press Club that Thriving Kids was being set up. Our first advisory group meeting was September the 30th, and the final report was handed to Minister Butler 2 days before Christmas on December the 23rd. Next slide. And that was the end of the formal work of the advisory group. And we understand that up until now, there's been a huge amount of work that's been undertaken by the department around various issues that we identified, and of course the bilateral consultation with the states. So neither Anoo or I are privy to any of those discussions or any of the work that's being done by the department. So this was the outcome. We see this as very much a prevention, early intervention model, and it removes the need for diagnosis to receive services. It changes the language from what is the diagnosis to what needs and supports does this child and this family need. It's very much a settings approach. You've heard the Minister talk about this. It really focuses on where children live, learn, and play. The focus is not only on the child, but very much on the parents and the family. It's designed not just to make a diagnosis, as I mentioned, but really to find out what the parent needs are and then build their capacity and capability, because you know better than I that that's key to good outcomes in children, but also building the capacity and the capability of the providers. So all of the universal services, childcare, MCH nurses, family day care, general practice, to build their capacity and capability. And it strengthens systems of identification, clinical systems, and referral pathways. And it really focuses on a functional assessment, identifying strengths as well as weaknesses. What does this child in this family need over the next 6 to 12 months to thrive? So as a pediatrician and as somebody that I think understands child development, it ticks a lot of the boxes for me about what an ideal system might look like. There are challenges, as you would expect, in transitioning from one system to the other. Even if it was a bad system to what we hope is a good system, there are still challenges. The expert committee was very mindful that this isn't all going to be happening by next week or even next year. But what we've tried to do is to develop a strong conceptual model, a sort of high-level structural model that hopefully will inform policy and service delivery, not just at the launch, but in years to come as well, which really addresses some of the challenges that NDIS provided for kids. Perhaps we'll stop there, Denise, and as you said, there's lots of time later on for questions.
Thanks, Frank. Anoo, I'll move to your slide if you're happy to come onto screen.
Yes, thanks, Denise. So thanks, Frank. That was really good, the background and process. So I get the honor of actually talking about the model and what I think most of you would have had a chance to glance at the model. And even though it looks like a one page, It took lots of time and effort, and I was really, firstly, really excited to be on the expert advisory group, but also, as Frank mentioned, getting that response from the minister, and the group was really dedicated and gave it our best. So very quickly with the model, it provides, so this is called the Thriving Kids model, and it provides a national roadmap for a system of early childhood supports that are aimed at children aged 8 and under with developmental delay, neurodevelopmental differences, autism, and primarily who have low to moderate support needs. So the model shows that by identifying needs early and providing supports, which is really important for all of us, is providing supports in the child's natural environments where children live, learn, and play, developmental trajectories can be shifted towards improved lifelong well-being. The model begins with identification of potential delay. It recognizes that identification is an ongoing process rather than a one-off event. And children without a diagnosis can also enter the model. So the report proposed that it's strengthening multiple pathways for this early detection, including parents, family, friends, early childhood educators, general health services such as GPs, child and family health nurses. So there are multiple pathways. A key proposed feature for national consistency is also the introduction of the 3-year-old health and developmental check to ensure concerns are not missed before a child reaches school age. Once a concern is identified, the model provides multiple intake points and soft entry pathways. This approach ensures that families can access accurate advice and be connected to services regardless of where they are or where they start their journey. And these entry points range from self-directed, they could be digital, phone-based wayfinding, to more active entry points where professionals undertake an assessment of functional needs to match children with appropriate supports. So as you can see, at the heart of the model, it's a stepped system of support matched to the family's level of need. And that was really significant for, I think, all of us on the panel, on the advisory. So you can see it's best practice, universal parenting supports and information. So these are aimed at empowering parents as a child's first teacher. They include online resources, peer groups, supported play groups, anything really that is intended to build family capacity and well-being. And then best practice targeted supports. So these are for children needing more individualized assistance. The model offers time-limited, goal-based services. Again, we don't know what it will really look like, but this is what the model proposed. These may include allied health services, access to low-cost assistive technology delivered in community-based hubs, homes, educational settings, really where children live, learn, and play. And finally, the model is designed as a continuum. So you can see that it integrates with the NDIS for those with significant and permanent disabilities. So as Frank started, so that children who, when, there were lots of children on NDIS, and so this hopefully the Thriving Kids still integrates with the NDIS for children with significant disabilities, but ensures that vast majority of children with low to moderate support needs are supported quickly, effectively, and within their own communities using best practice. So I'll stop there, Denise.
Okay, well, I might stop sharing because we don't have slides. And Kerry, I think you were going to do a little bit of a summary in relation to the Thriving Kids Advisory Group report and the PRECI discussion paper on Thriving Kids.
Yeah, thanks, Denise, and Anoo and Frank for your introduction. That was really helpful. I do want to just talk briefly from a PRECI perspective. You might know that PRECI distributed a discussion paper on Thriving Kids in February, and it's available on our website. And from PRECI's perspective, there are many positive features of the proposed national model, and Frank and Anoo have both highlighted some of these. But I want to give some examples of what we think are those positive features. So firstly, the model doesn't set up a separate disability service system as it might have done. but locates services in mainstream settings. Parents no longer have a funding allocation that they are responsible for, which is an improvement on the NDIS model. There's not a requirement for diagnosis, and there's a focus on the needs of families as well as children. It uses a strength-based approach and seeks to build the capability of parents, carers, and families. And as Anoo's talked about, this focus on early identification and prompt access to services is positive. As is having multiple ways of identifying potential delays, and importantly, this focus on workforce development. However, we note that the model doesn't incorporate all of the principles and practices that underpin the National Best Practice Framework for Early Childhood Intervention, and we think it's important that they are all considered. PRECI's discussion paper identifies key issues to be addressed in designing and implementing an integrated universal thriving kids and NDIS service system, and we make more than 20 recommendations. So we think it's an important paper for you all to have a look at. These issues that we raise will be addressed in subsequent PRECI seminars. You know that there's a series of seminars on thriving kids that are being put out through PRECI. But that's all from a PRECI perspective. We really want to hear from you. So we're going to open up for questions and answers. You're very welcome to put comments or questions in the chat, and we just remind everyone to please keep comments and questions respectful. If you're wanting to come off on screen, you're very welcome to do that too, so that we can now have some open question and answer, and the PRECI members will manage that chat. So over to you all.
Thanks, Kerry. And I can see there are quite a list of questions that are coming up in the chat. So we will look at how we raise some of those. But I was wondering if we started with one that I know has been commonly asked, and that is, I think, the professionals. There's been a mention of workforce and what professionals are being considered within the allied health. No, I'll broaden that out, within the Thriving Kids program as being a part of that program. So Frank or Anoo.
I think all of the professionals who come into contact with children, the settings approach, we sort of adopted a settings approach, so where children live, learn and play. So they go to childcare centres at early learning, they go to family daycare, they go to maternal and child health nurses, they go to GPs. So all of those settings where children and parents come into contact with professionals, our intent was two things will happen, or three things. One is that the professional will engage in a conversation with parents, and I presume they have that relationship already. They will elicit any concerns that parents may have, so that'll be part of an early identification process. And then we'll give parents appropriate information, not just about their concerns, but relevant to child development. How do they create the most appropriate, stimulating environment for young children? So the professionals that we had in mind weren't restricted, though all of the professionals who make contact with children, and in addition to the specialists, of course, the allied health professionals, paediatricians, psychologists, and so
on.
Thanks, Frank. See
Frank.
People with their thumbs up, so that's great. Sorry, Susanna, you go.
Yeah, thank you, Frank, for that. There are a few of the questions related to what services will be considered targeted or not. And I understand you did have a bit of a deep dive session around that too. What is targeted, what is universal, etc. Could you elaborate on that a little bit, please?
Yeah. Well, I think targeted services are those that are beyond the expertise of the universal services, so that if a MCH nurse or a GP or a school teacher felt that they didn't have the capacity either to understand what the nature of the problem was or to support parents, they would then seek a targeted service, which might be adult health professionals, it might be a paediatrician, but it would be somebody with a high level of expertise, of appropriate expertise than they had. So, where possible, we want to really try and our intent was to really try and strengthen all the universal systems where children come into contact, families come into contact. But we recognize that for many of these, or some of these encounters, there's a level of expertise required beyond that, and that's targeted services. Services will be targeted to the nature of the issue that the child and the family has.
Thank you, Frank.
That's your question, Susanna.
Thank you, Frank. The follow-up question to that was, I guess because community health centers, at least in Victoria, are a mix of universal and targeted. They would fit that kind of scope of supports for children and families. Yep. Thank you. That's good.
Kerry?
Frank, there's a question about the pathway for children who might start with being involved in Thriving Kids and then move on to needing NDIS supports. Could you talk a little bit about that?
Yeah, we didn't discuss that in detail. Those pathways will continue to exist. Clearly, a number of these children will have complex issues, will need NDIS funding, and hopefully those children will be identified early and won't need a diagnosis. So I guess the pathway will be from parent concern or professional concern to some sort of an assessment by either an individual or a multidisciplinary group. And that assessment, that formulation will come to the conclusion this child has significant issues and needs NDIS. So that pathway, that process will continue, hopefully in a more efficient and less cumbersome way that's been in the past.
Thanks,
Anoo,
Frank.
you may want to add to that, Anoo.
Sorry,
She's not there.
I couldn't get to my mute button. Yes, I agree with that as well. So there was, despite that, there's also going to be some newer additions to the pathways. So we feel one of the things that was discussed a lot was that no child is left behind, or doesn't miss out. So I think just being mindful of that. We did recognize that there'll be lots of capacity building required, but it was still meant to be overarching supports.
Thanks, Anoo. Not a lot, but quite a few of the questions of participants are about implementation of the framework. And that's a bit of a crystal ball at this point in time. But in terms of what it means for parents, for families, and obviously for services, but a few questions about for families and what will families need to be prepared for in terms of when the Thriving Kids initiative will be implemented.
That's a sort of broad issue. Look, I think the challenge for government now, as Anoo has just said, is to develop programs, training programs, professional development programs, workforce strategies in the medium to long term, so that where parents do go to those professionals, they'll be better prepared to elicit concerns, address concerns, refer early, and so on. That'll take time. I don't underestimate the minister's commitment to this, as I mentioned before, and the experience that Anoo and I and the advisory group had of the Secretariat was they've worked damn hard and they listened to all of the conversations, and we know that they've been busy this year trying to not just negotiate appropriate agreements with states, but also to begin to develop those sorts of professional development programs, parent awareness programs, and so on. What we want to do, what we hope will happen, is that child development will be elevated in terms of parent understanding as an issue, parent awareness, reduction of stigma, increased expertise for professionals. So I think it does create, hopefully the framework does create those sorts of opportunities for increased awareness, early detection, prevention, and so on.
Okay, thank you, Frank. I just wonder whether there is a follow-up question to that. Kerry?
Not necessarily a follow-up, but there's quite a cluster of questions about the assessment of need and whether this will be a single tool like ICANN or how that'll be managed.
My understanding is that the government is working on a single tool, but I think there'll be a range of early detection mechanisms which will be appropriate to the setting. So an early educator, you wouldn't expect to have the same sophistication or training or expertise as a pediatrician, for example. So in those settings, it may be simply asking parents the question, do you have any concerns about your child? Or making observations in the early years setting that this child is not developing as well or is aggressive to others, etc. And then there'll be a staged early identification process depending on the setting and depending on the expertise of the person. So MCH will be a level higher again. The government is very keen to strengthen the role of GPs and will be putting in place some sort of credentialing system and training program. Pediatricians do that as part of their work anyhow. But in addition to all of that, my understanding is that the government will be working on some sort of functional assessment. And to just jump in.
Yeah, look, I'm also looking at one more question is what's the difference between NDIS and thriving kids? Like, I think that came up repeatedly. And perhaps just at the start, I can just say that that was discussed as well. And both systems don't need a diagnosis to get in. And Frank, jumping if I've got this wrong. I don't think I've got it wrong, but I think the clarity was in NDIS is more for significant and permanent disability. And so currently, all the children were into the NDIS without a diagnosis or with. And one of the main, I think, reason for Thriving Kids was to separate that out so that children who still have needs, maybe low or moderate support needs, but not a permanent and significant disability, will have a different system of support and that their parents and families can be supported in slightly different, following best practice in slightly different way. And so that's why I think that's the main difference. It doesn't mean that children with no diagnosis cannot get into NDIS. Right now they can, but we're hoping that once the Thriving Kids comes into place in 2028, then children with low moderate support needs can have a different pathway. Frank?
Yeah, no, I agree. I think the other thing that will hopefully happen is the focus will be on parents as well as the child. Changing the language away from deficits towards needs, in my mind, is a significant departure. What does this child need rather than what's the diagnosis? What does this family need? If we can affect that smoothly, I think that'll be a major shift.
There is another few questions around allied health providers that are set up and in private businesses and ECEI, NDIS, and there's a bit of unsurety, uncertainty around what's going to happen. So perhaps Frank, if you want to comment first.
Well, we certainly discussed that at length in all three of the meetings that we had. We understand that this may be a changed model for many of the allied health professionals in private practice. We're also aware that some of the practitioners mortgage their houses to set up their private practices. We're very aware of that, and the government understands that there will have to be some transitional arrangements to respect the needs of those professionals.
Yeah, I agree. And just so that everyone feels that, it was represented well in the deep dives. So we had deep dives with most of the allied health peak bodies joining in, and we've listened to that their perspectives, and they're very well aware of what's going on. Also, psychologists and special educators. So everyone was, I think, had a forum. So just putting that out there as well. I mean, I don't have the answer to that, but I do feel that the NDI system will still be there. But then I think this new system perhaps will not need an entirely new skill set, but it will It's more so for parents and children and families rather than service provision. And we were quite mindful of that in the advisory committee as well.
I think also, thank you, Anoo. Just some of the comments and in the chat referred to the fact that a lot of participants indicate that they have skills around play and parenting, etc., which is fantastic. But one of the things that keeps coming up is about the famous key worker model, and perhaps a misunderstanding of the different terms associated with it. And I just wonder whether you, Anoo, or Frank might want to talk about that a little bit.
And if you want to tackle that first.
I'll have a go. So this is something. So the key worker, as we know it, I don't think that's what is represented in the Thriving Kids report. I think we were still coming up with terminology. So really, it is a person who will be like a coordinator or a liaison worker. So, and we're quite mindful that the term does not really match with the term that most people are aware of. Denise, you probably can explain what the key worker to us means, but it's more for me, it's the transdisciplinary key worker model, but I don't think that's what's written in the Thriving Kids report. It's more like a liaison worker who works closely with the family and will be coordinating services.
Yeah, we discussed this again, I think, at every single meeting for a long time. We came up with navigator, coordinator, key worker, etc. But to my mind, if we talk about functions rather than names, somebody has to point the family in the right direction, in a sometimes confused service system, so that that can be a sort of targeted intervention. Then somebody has to hold the family until they get the supports that they need. Then somebody has to make sure that they get the services they need, particularly complex kids that have a multidisciplinary assessment. Then somebody needs to continue to work with the family to review regularly and make sure their needs are being met. So there's a number of different functional roles, and I don't think any single name quite comes up with that. But there's different roles at different stages in the referral process.
Yeah.
If I can jump in, I think there's quite a cluster of questions about workforce. Questions like, will providers need to be registered with Thriving Kids? Where does the workforce come from? And where does the funding come from? If we could just address that, please.
We discussed registration, and I think we came up with a final position on that. But the government is keen to have some sort of quote unquote control over that workforce, but based on their experience with NDIS, which was a sort of market-driven system. We did identify significant workforce shortages even before Thriving Kids. As a paediatrician, every single professional group working with children, there's a shortage. Early educators, childcare workers, MCH nurses, paediatricians, speech pathologists, OTs. That's not going to be solved overnight. But the colleges and associations are certainly aware that that's something they need to address. When we undertook the National Children's Mental Health and Wellbeing Strategy, we identify those shortages again. There just aren't enough trained people working with these kids and families at an early stage. So inevitably, you get to long waiting lists and so on. Hopefully, the government will resource the colleges and the training programs so that there will be changes in the medium term.
Frank, there are some questions around the differentiation between mild and moderate level of disability. And I'm just wondering whether the advisory group actually had to address that, because that was the charter that you got. But in actual terms, I'm just wondering whether it is a much more fluid process in terms of, and not having to
Yes, of course it is. One of my bugbears is categorizing kids like that. We know that child development and need is a continuum, and cutting the line and categorizing is a totally artificial construct, mainly to make it easier for government bureaucrats to allot services. But yes, it's fluid, it's a continuum, and it'll be very much at the level of the expertise of the provider, of the clinician making those assessments. So for quote unquote, at one end of the continuum, there are families and children who just need reassurance. And
Yes.
there's a continuum, a seamless continuum, hopefully, all the way through to those children and families with complex problems and very high level of needs and everything in between. So I think the mild to moderate was a way of Minister Butler saying not all of these kids need to be on the NDIS, that many of them can be catered outside the NDIS.
Yeah.
And just to clarify, Susanna, it was not mild, moderate disability. It was low to moderate support needs. So we made that very clear in the advisory group that we're not going to say a moderate or mild disability.
Yeah. Thank you for making, that's an important distinction, I think.
Yeah. Yeah.
And part of our efforts to change the language.
Yeah. I just wonder whether somebody would like to ask a question direct, not in the chat.
I'm happy to do that.
Oh,
Mandy
great.
here from Family Advocacy. As an advocate, I would love you guys to address the continuing trauma from the initial announcement of Thriving Kids and the comment about autism not being a lifelong disability. Thank you.
I can't take responsibility for the initial announcement. I got one day's notice that the minister was going to announce this at the press club, and I just saw it as an opportunity. I'll probably get into trouble for this. There's autism and there's autism. And there's, in the same way as Susanna said, there's a continuum of need for children and families. There's a continuum around what people consider as autism. And I personally, and this is where I'll get into trouble, have problems with labeling children with mild autism. I think that there are clearly those children historically for whom the diagnosis is appropriate. These are children with often permanent, lifelong family needs. But a lot of the children that get labelled with autism, I think, shouldn't have that label. I think it's been heightened by the need to have a diagnosis like that to get into NDIS. That's not to say these children don't have needs, don't have developmental weaknesses. Of course they do. But I don't think that with Thriving Kids, having a label like that is going to do them any favours. And push back. And, I know I might be an outlier, but that's where I've landed after a lifetime of dealing with these children. That my approach is to describe these kids in terms of their strengths and their weaknesses, particularly their needs and what do they need. And same with ADHD, and same with a lot of these disorders. I think that for many of these children, labeling, giving them a diagnosis doesn't do them any favors. I know that doesn't quite answer the question or gives you the answer that you wanted, but there you go.
Frank, I had a question for you actually, because I had read some articles and a podcast that you had spoken in, and you had made reference to, children only need 1 or 2 sessions of speech therapy and they're on the NDIS. And I'm just a little bit confused because when I heard that, I was like, oh, wow, I've never serviced someone who's got NDIS funding who only needed 1 or 2 sessions. Those families are often, supported through, a few sessions of private therapy, supported through Medicare or community health. So I just would like some clarity as to, this understanding that children have been on the early intervention program for NDIS, and they've only needed, short-term therapy. Because as an allied health provider, and I'm sure there's a lot of allied health providers here, I don't think anyone that we've supported through the NDIS are only children who need 1 or 2 sessions of speech therapy, even like the mildest cases that we see of speech therapy. It's really not 1 to 2 sessions that get the outcomes that we need. Yeah.
Lots of applause for your comment, and we're on the same page. I'm sorry if that's how my comments were interpreted. I guess I didn't mean to refer just to children on NDS. The point that was, look at all those applauses, unless that's the one person making all those applauses. What I meant to say was there are children that have speech delay or some issues that they need to be referred to an adult health professional. Some don't need long-term therapy, is what I meant to say. A number of children I see in my practice, I refer to a speech pathologist, they have 1 or 2 sessions, and these aren't the children necessarily on NDIS. So I didn't mean to infer that children on NDIS, many of them needed 1 or 2 sessions.
Yeah, I think it's just been interpreted like that because obviously Thriving Kids has come in to kind of replace that early intervention sector of the NDIS. So I think a lot of allied health providers are a bit confused as to why we're comparing those families, because those are not really the families that are needing that support. Those mild cases at the moment, they're able to access services because those cases are quite mild and therapy isn't long term. Yeah, so it's just a bit, I think it's misleading for people who don't work in health, hearing this, yeah.
No, we're in agreement. We're on the same page. That's a misinterpretation of what I intended to say.
And I think, Erin, thank you for raising it and Frank for responding. And I think there's a lot of people on the call who can now support that and correct that misinterpretation. So I think that's really important. Yeah, thank you. I can see Kobe, you've got your hand up.
Thank you. And I do want to congratulate the PRECI team, the panel, for the framework and everything, which is best practice, it's evidence-based, but I do think there's some big operational structural difficulties that will make it really hard to implement, including workforce. Majority of the allied health sits in private practice, and it looks like it will be a government sort of commissioned service, which many private practitioner allied health will potentially not be able to be part of that system. So workforce is a big thing, identifying the delays, but also for ongoing support. So just wanted to hear whether there's been any thought about how private practitioners and allied health will be part of this. I've been involved historically in private practice before NDIS, so I know how hard it is to keep a business running that way, and I've been part of NDIS. So this for me is going back to that previous system where families can't access allied health.
Yeah, I think I can't speak for government, but I think we were certainly very conscious that this is a hybrid system and has to stay a hybrid system. And there will be children and families that will continue to see professionals privately, and there'll be those that will go to commission services. And certainly there was never any intent or discussion about changing that.
So there potentially won't be room for private practitioners because that funding through NDIS is not going to happen in the future.
No, that's not what I said. I said there was an acknowledgement that there is a hybrid system and there will stay a hybrid system, and that many of the children who fit into the Thriving Kids model will continue to access private services.
Funded by families themselves?
Or funded by families themselves, or insurance, or...
Yeah, there's very limited Medicare funding available for families who can't afford allied health.
Then they'll go to commission services.
Yeah, so there's been many private practitioners who won't be able to keep their services going. Yeah. So thank you, that clarifies it.
Thanks, Kobe. I think this is a question that has arisen, quite a bit in relation to the private practice area, certainly through our consultations, and obviously from a PRECI perspective, we don't necessarily look at the type of service, but the quality of the service and those that are providing best practice. But I can see we've got 8 minutes left. But Belinda, I can see your hand up there.
Yeah, hi, thank you. Yeah, I'm a counsellor and a play therapist. 80% of my clients, I'm in private practice. 80% of my clients are on the NDIS. So I guess my question is just a practical question, because I'm at the point, do I just close up and do I then apply for another job? Or I would like to know practically, is there going to be a pathway to be involved in the Thriving Kids? Is there training opportunities? What does that look like for us as therapists? Could we be involved? Because I'm happy to stick it out and just see if I can be involved in some way, but I just want to know, is there any job opportunities for us? Because there's going to be so many out there. Do we just all close up our businesses, or could we be involved in the Thriving Kids program?
Well, I would hope strongly you don't close up your business. I think there's definitely room for trained people like yourself. We didn't get into that detail. We really tried to develop a high-level framework that would guide future policy, future funding allocations, and we very much considered the framework in terms of best practice. I think a lot of that detail will just be sorted out at a state level. A lot of the targeted services are state funded, not federally funded. So I would hope very strongly that you'll continue to practice in the way that you do, and that there will be opportunities for you to do that.
Thank you.
Thanks, Frank. I can see Trails Early Learning has their hand up. I'm not sure who's behind that. Sorry. Thank you.
Hi, Annalise here. I have a question in regards to, I guess, how will funding actually look like? Will funding be provided in block funding to those settings? Will that funding be provided to families to use in those settings? As someone that works in inclusion early childhood, we have a lot of children with support needs across services, and that's where children play and learn. I guess, how does those supports work, and I guess the funding work through those settings? Would love a bit more explanation around that. Thank you.
I can't answer that in detail. The federal government will provide resources and training and so on to those services they've got control over. So early learning, general practice, a lot of the other services are state funded. I don't think Thriving Kids model does not consider that parents will get a bucket of money. They'll be eligible for all the usual support services that exist now at a state and federal level. The disability programs for schools will continue, ISP will continue. So in that sense, families will get support, but we certainly didn't discuss families getting an amount of funding. Anoo, you may want to just add to that.
Yeah, I'm pretty sure we didn't go into that detail as well, Elise. So I think just I can hear the I don't know what the right word is here, but just there was a lot of discussion around getting the framework right first, and then looking at, I think we've jumped the gun and looking at the business model already, and I completely get that. But I think it's important to also remember that that's not what was discussed at the advisory. It was setting that framework, getting the model, and then the next step. So I think a lot of questions, Frank, you're doing really great by answering those, but also there's a lot of uncertainty around what's going to happen and how it'll be operationalized. And I think together that's something we can think about, so that the ultimate goal of the children and families. And I know people think that not many of us are working on the ground. I certainly work on the ground. I work with children and families even now, and I can appreciate it can look very different, but I feel there was a lot of children and families that were missing out even in NDIS. So hopefully we can get in there early, and I still don't know what it's going to look like, so I can't say I know. But I think that's the part where we all will have to come together as a workforce and see that we use best practices when we guide practice. So, yeah, sorry, I can't answer that.
Yeah, that's okay. Thank you.
And look, just before we will try to get in a couple more questions, but I just wanted to mention I have put up a poll for people to write their comments in. We have got a series of webinars that we will do. This one was particularly on practice, and I think just some of the questions that I'm hearing are the same challenges that we had with the development of the National Best Practice Framework for Early Childhood Intervention. It's the implementation, it's the development of the framework is there, and a lot of work goes into it. And I know a lot of you on the call put so much work into supporting the development of that. And I think that is what's happened here as well with the Thriving Kids Advisory Group and the model that they have put forward. The next steps is up to all of us, as well as some of it being out of our control, but all we can continue to do is advocate, because we certainly hear what people are saying. We understand absolutely the concerns, and for all of us, the outcome is for the children and the families, and that's what I think we need to keep in our heads. So, Anoo and Frank, the challenge of putting together and the robust and comprehensive way that your model was developed, it is that next challenge, isn't it, of implementation. And so, again, for people to understand that the Thriving Kids Advisory Group is not necessarily responsible for that next part. We all are, in fact, in some respect. So we've got two minutes to go. Sarah, is it a quick question? Am I going to put you on the spot for a quickie?
It was just about within the national framework, will it be up to the states or the state's prerogative to determine how that commission service work, or will it be fairly standard throughout Australia?
No, it'll be up to the states. If I could just echo Denise's comments. I think the first step is to have good policy settings, and that's what we tried to do with this. And the implementation of policy is always challenging. We would have liked to have central guidelines for commissioning, and we weren't successful in that. That is the expert advisory group. I think the minister wanted some flexibility in his negotiations with the state. So the commissioning and those decisions will be at a state level mostly.
Thanks, Frank. Erin, do you have a quick question for a minute before we wrap up?
Thank you, Denise. Mine was sort of echoing some what has already been discussed regarding the expertise and skills that are in the private sector, and whether or not there will be opportunity to utilise the whole workforce, as there is currently not enough. Like, we have massive shortages, so it will be necessary to actually utilise the full workforce. Sorry.
Yeah. Anoo?
Sorry.
And if there is any plans for how to do that. Sorry.
I don't have the answer, but I can say that I feel like they both are not separate things, the workforce. I feel like some of the comments that I'm reading, I feel like people think that the workforce is wasted, but I do not think that. I feel like that workforce that is there will be the workforce that will be moving to Thriving Kids. I still don't know how, because, that's the operationalization. But also, I think there'll be opportunities for future workers, because I do work in the, business of the university and, the future of our workforce. And I feel like that's something that I feel hopeful about in the future, that I don't think that people will lose their jobs and private practices. It'll have an impact, but I think it'll reframe and come back in different ways that'll still be helpful. So that skill set will not be lost, I don't think. I don't know. That's what I think.
Thanks, Anoo. Look, we have hit, I'm going to say 10 o'clock here because I'm in WA, 1 o'clock or multiple different times across the country. Look, thank you. Please keep, completing the survey. As I said, we do have another webinar coming up, and Dr. Tim Jones, who is also on the Thriving Kids Advisory Group, will be attending that one. And so, we're going to keep exploring this over a series of webinars. But I would like to really thank Professor Oberklaid and Anoo for taking the questions today and starting us off really on this series of understanding what the Thriving Kids Advisory Group really had as the intent, and what we can read, I think, through the Advisory Group report. Thank you.